Hello, my name's Susan Cunningham and I'm Professor of Orthodontics at the UCL Eastman Dental Institute in London.
My name is Rachel Stevens and I recently completed the graduate training programme at the Eastman Dental Institute, and the paper we are presenting was part of my master's research.
Information-seeking behaviour is becoming increasingly important in all aspects of dentistry and medicine, yet there's relatively little research in this field in orthodontics. Therefore, the aims of this study were to find out exactly what patients wanted to know about their treatment, to find out how they go about searching for information, and to ask how they would like the information to be provided for them.
The study was in two parts and included patients aged 10 to 16 years who were about to start or were in the early stages of fixed appliance treatment. The first part involved in-depth interviews, and the information from these interviews was then used to develop a questionnaire which was distributed to a larger cohort of patients. 15 patients were interviewed, and the main themes focused on the different methods patients had used to obtain information.
These themes were then used to develop the questionnaire, which was distributed to 50 patients, again aged 10 to 16 years of age. And we've selected just a few of the interesting findings for this presentation. The information which patients felt was most important for them to know related to management of pain, oral hygiene procedures, and the general effects of wearing fixed appliances. However, a third of respondents wanted to know exactly how a fixed appliance would be placed and whether or not a drill would be used. Therefore, these areas are clearly important to address when we're communicating with our patients. The majority of the patients had read the information leaflet we routinely provide, but 18% of them thought it was quite difficult to read, and several respondents suggested developing different leaflets for different age groups, perhaps with cartoons rather than clinical photographs for younger patients. However, it was the findings regarding use of the internet which were perhaps most surprising. 64% of respondents use the internet every day, either for homework or social networking. But a minority, only 8%, said that they would use the internet to find information about orthodontic treatment. When respondents were asked what search terms they would use, nearly all said that they would use the term braces rather than orthodontics. Yet few of the reliable websites rank highly when this term is used. So organisations such as the International Orthodontic Societies should work to enhance their rankings when non-technical search terms are used.
When asked their single preferred source of information, the majority selected verbal information, talking to their orthodontist, parent or general dentist. So even in the internet age, verbal communication remains the preferred choice. This highlights the importance of educating parents and general dentists so that they too can provide accurate information to patients.
Surprisingly, only 4% selected the internet as their preferred source of information, although we do acknowledge that this may vary in different countries. But this does mean that as a profession, we need to look at ways of using the internet more effectively. For example, the increased use of videos on social media sites. Nearly all of our patients use social media sites, and a number of respondents said that they would find videos helpful in reducing their anxiety about forthcoming treatment. However, some respondents were concerned regarding the reliability of online information. And as we mentioned earlier, reputable sources should work on enhancing their rankings when non-technical search terms are used. This would then allow clinicians to direct patients to appropriate sites and would hopefully optimise the use of reliable online information. So in conclusion, the paper that we've presented here highlights the importance of the profession continually looking at ways of improving information provision. We hope that you find the paper interesting and that you enjoy reading it. Finally, we'd like to finish the presentation by thanking Fiona Ryan, who was a co-author on the paper, and thank you all for listening.